everybody. My name is Jeannie Rouse, and I'm a nursing student with Indiana State University. I'm doing a presentation today just to go over about the new pandemic that's happening, the COVID-19 pandemic, some information that will help you learn how to stay safe. So in this presentation, we're going to go over some learning objectives. At the end of this presentation, you should be able to explain what the coronavirus is and how it spreads. You should be able to construct a plan to engage in social distancing and prevention of spreading the disease. You should be able to list the signs and symptoms of coronavirus. You will be able to identify when to seek emergency medical services, and then you'll be able to describe what contact tracing is. So what is coronavirus? So the new novel coronavirus is the new coronavirus that has not been identified. The virus that causes coronavirus disease 2019 is not the same as the coronaviruses that are commonly circulating among humans currently. Those ones are known to cause mild illness, and the common cold. So COVID-19 is like the name of the coronavirus that has been shortened by the World Health Organization. It's the official name, and just helps it then classify the disease. This coronavirus outbreak was first identified in Wuhan, China. And public health initiative to quarantine has shown and to effectively reduce the spread of the virus. And according to the National Institute of Health, we have delayed about 530 million people with the virus. And how does it spread? So currently there's no vaccine to prevent coronavirus, and the best way to prevent illness is to avoid exposure to the virus. It is spread mainly from person to person via droplets from spit, talking, sneezing, coughing, between people who are in close contact with one another, like within the 6-foot range. Like I said, it comes from respiratory droplets that are produced when the infected person coughs, talks, or sneezes. The droplets can land in mouths or noses of people who are nearby, or you can inhale them, or it could be on surfaces where you touch and then you proceed to touch your mouth and your eyes. Some recent studies have suggested that COVID-19 may be spread by people who don't show symptoms. So how to stop the spread of the disease? So currently there is a lot of public health initiatives right now. You need to wear face masks in public settings, out in areas, the grocery stores, things like that. Children under the age of 2 are exempt, but try to get them a covering as well. Wash your hands often. Wash them with soap and water for a minimum of 20 seconds, especially after you've been out in public or after you've coughed, sneezed, or blew your nose. Especially important to wash hands before eating and preparing food, before touching your face, going to the bathroom, changing a diaper, caring for anyone who's sick, touching any kind of animal, things like that. If soap and water are not available, hand sanitizer that has at least 60% alcohol will be efficient. Cover all surfaces that you want with alcohol sanitizer and just rub until it's dry. Avoid touching your eyes, nose, and mouth. And here are some symptoms of the coronavirus. Just keep in mind, people with COVID-19 can have a wide range of symptoms that they have reported, ranging from mild to severe. Symptoms usually show up within 2 to 14 days after exposure to the virus, but some of the symptoms you may or may not have include fever or chills, cough, shortness of breath or difficulty breathing, fatigue, muscle aches or body aches, headache, a new loss of taste or smell, sore throat, you can have congestion or runny nose, you can have nausea or vomiting and diarrhea. Testing, who can get it? It really just depends on the area you're in. Not everyone needs to be tested. It's not really recommended that you want to get tested just because. If you'd have any of those symptoms listed on the previous slide, it's definitely best to call your healthcare provider to go get tested and find out where to go. You can also visit any state or local health departments. They are usually offering free drive-up testing as well. There are 2 types of tests currently available. Right now they're doing the nasal swab or a nasal pharyngeal swab. Those are both going up into your nostrils. And some areas are also doing antibody testing for people who want to check to see if they have antibodies and have been exposed in the past. I know Kaiser Permanente is offering antibody testing to their members based off of certain guidelines, and it's for research purposes only, so it's not a definitive test as well. When to seek emergency care. So these are symptoms you need to really monitor yourself or anyone who is sick for. Trouble breathing, any kind of persistent pain or pressure in your chest, new confusion, inability to stay awake, or inability to wake up, kind of like lethargic, you can't wake someone up. Any bluish lips, blue face, any kind of blue color, gray, ashen, it's really not that great either. Those are some things to look out for. Those symptoms, you should definitely call 911. Do not try to load someone in a car. Call 911. Let the operator know that this person is in fact sick with COVID-19 so they can take proper precautions to enter your home. This is just some information about children and COVID-19. You can encourage your child to stop the spread of COVID-19 by teaching them to do the same thing that you're doing. It's to stay healthy, like face coverings when out in public, washing their hands, not touching their face, trying to keep social distancing to a minimum. It's very good to ensure good routines, keeping the same routines for your children so they're not scared. Reassure them that they're safe and that they're not going to die or get it, things like that. And then contact tracing. I know this is started here in Oregon State for contact tracing, but it's used by health departments to prevent the spread of infectious disease. In general, contact tracing involves identifying people who have an infectious disease and their contacts, which are people who may have been exposed to that person who has the disease. And then it's working with those individuals to interrupt the disease transmission. So for COVID-19, that includes asking cases of people who have it to isolate and to quarantine at home. Anyone who's come into contact with someone who has been known to be infected are also asked to quarantine at home. So the contact tracing right now, people are they're providing interviews with people with COVID-19 to identify anyone with whom they've had close contact with, just to inform them. They are notifying any potential contacts that have exposure to known individuals. They're also monitoring contacts for signs and symptoms just to see if they actually do get it or not. And then they're connecting contacts with services they might need to self-quarantine during those periods. So to prevent the further spread of the disease, COVID-19 contacts are encouraged to stay home, and they are told to maintain social distancing from others for at least 14 days after their last exposure to a person with COVID-19. So people who have come in contact with anyone should monitor themselves by checking their temperature twice daily and checking for symptoms that we've listed before. So a close contact is defined as anyone who is within 6 feet of an infected person for at least 15 minutes, starting from a 48-hour period before the person began feeling sick until the time the patient was isolated. Discussions with the health department are confidential. Nobody will know your personal or medical information in terms of contacting. That will be kept private. The only people who will be notified for something like that would be like a healthcare provider. So this slide is for resources for anyone who wants information about the coronavirus. For veterans, this website right here is letting you know what the VA is doing in terms of testing, where they're offering it, how that works with for your benefits. Since everyone's been in quarantine and we haven't been able to have access to a lot of individuals and you're self-isolating, mental health can really be an increased issue. So we have the suicide prevention hotline just in case you are feeling like you need to talk to someone or having feelings of suicidal ideation. We also have a number here. It's also available in Spanish so that you can talk with some people just about mental health things so that you can get some help while you're in quarantine. This is the CDC website over here. This just has a lot of information about the coronavirus, things they're doing to stop it, how they're tracking it, symptoms to watch out for, how to care for yourself, information about travel and children. And then Multnomah County within Portland, Oregon, This website lets you know where they are offering walk-up testing, free testing for coronavirus. We've got a lot of different clinics out there in the Portland metro area. You can also call your major insurance provider, or you can just go, they'll let you know, do not go to an ER to get testing. They do not offer testing. Please do not do that. There's also a flyer at the end in the comment section, and a pre and post test. Please do those tests prior to watching this video. Thanks, everybody.